have significant imposter syndrome.
That you seem to be using to your advantage in this instance.
Which keeps me on the edge of my seat. Jokes aside, like I think that does drive me forward though, because I do want to put my best foot forward for patients and for myself. There's like that element of like I would like to know as much as I can, but it's impossible to do that. Um, I think the again, like through the writing process, what was really helpful for me to do was to talk to some colleagues at the same time to sort of get their insights and inputs on particular topics. And I think the confident clinician also does this beautifully. And, I've been part of your world since, the IMED Research Hub days. And it's nice to have some feedback to understand, is my understanding similar to yours? Or like, am I thinking along the lines, am I like missing something? Because sometimes when we get stuck in that black or white thinking, for me, my brain doesn't work that way. Like if you ask me a yes or no question, I'm gonna be like, maybe. It's really hard for me because I'm like a true overthinker. I joked about this on my first podcast episode. I think about thinking. And it's a problem in many ways, but it's also served me in many ways because it keeps me moving forward by asking questions and not settling for the status quo. But I think with time, to be honest, and with talking with and learning from other colleagues who are in a similar space, like where they're speaking and teaching and coaching, that as you advance your knowledge in a particular area, you also start to understand where the gaps are, and you can look for them moving forward, and you can also hope for them moving forward that those gaps will be filled, and you reach a point where you're like, okay, you know what, this is what we know right now, and then we'll pivot as more information comes, but for now this is good enough. And also, like when we're having and it's interesting because we're having conversations with colleagues often, and we're having conversations with the public or with patients. And with patients, ultimately, we can always say things like, this is what we know right now, these are some of our options, this is the best choice right now given where you are and what your circumstances, we can reassess in X amount of time, right? And I think that's sometimes what's lacking in the conventional system, and it's helpful for patients to hear some of that, because again, like in our short form content age right now, we are having like black and white, which and especially in hormonal health or even any kind of chronic illness, we need the nuance. And I think this is where a lot of us struggle as naturopathic doctors.
Yeah, it's interesting because you're saying like, oh, patients are relieved, right? When a little bit when we say like, this is what we know right now, this is the best information we have to make these decisions at this time. We're going to keep moving forward. We're going to keep learning. Patients do like that, right? Because I think they inherently know that medicine is not black and white. But when we say those exact same things to clinicians, they're like, no, just tell me the answer, right? Like, no, just tell me the dose. No, just tell me if I use it. No, just tell me if Karen, who wears purple turtlenecks on Tuesdays, would benefit from this supplement. It's hard for us as clinicians to sit in the discomfort of the thing that, like, the very thing that we try and use to comfort patients around, like, there's gaps in understanding. We're doing our best. This is what we know right now. This is my best foot forward for you in this moment in time. We're going to adapt this to meet your specific needs, right? But this is where we are. But clinicians want it to be black and white. And that's such a challenging piece when we go to educate clinicians, that they're like, no, just tell me the thing. And I'm like, well, no, there's no thing. We have a discussion about it. It's not, there's no thing. What's your experience been with that when trying to help clinicians understand the nuance?